your reflections on why this is important and what we've achieved together.
We've realised the potential of nursing, recreating some new focus on what nurses do with patients and families and friends, but we've also used methodology and data, and the combination together is very powerful.
Oh, it's massive. I mean, it's obviously we have to understand the needs of the patients, but also being able to involve the relatives a lot more.
Well, I wanted to get involved because I'm in finance. I wanted to sort of be part of the nursing teams and understand what they're doing on the wards, and it certainly helped me to understand how finance and nursing can work together.
For us, what came across is the teamwork that's really helped it and push it forward. We all had individual roles, and without that I don't think it would have quite progressed the way that it had.
With the teams on the ward, they've embraced it. It's been easy to identify the methods that we've used, and they've been able to adapt that onto the ward and progress with it, really, haven't they?
The quality of the enhanced care has definitely improved, that there's much more engagement with the patients, so the staff that are delivering that are clear about what they're doing, but we've also made a 20% reduction in the cost of enhanced care.
We've learned a lot in terms of enhancing the care that we've got, looking at our own policies, adapting them, bringing in new policies and nursing care plans.
It's been really exciting for me. Just having that networking opportunity of sharing learning is absolutely fantastic. It really motivates staff.
I think it's been impressive. Carers can do a lot in helping the patient.
What change do you think you've seen in your team looking back from the first event coming forward to this event now?
I think I've seen them move from not really knowing how we're going to go about improving what we want to do, and really focusing on specialing and collecting the data and understanding how on earth are we going to go about this, to feeling confident, getting to know one another, because they didn't all know one another when we started off. So getting to know one another, getting to trust one another and focus, and having that shared vision of improvement of what they want to do.
The biggest change that we've made with our PDSAs is the risk assessment. That's the one that I really have embraced. I think we've given the nursing staff on the wards a tool to put some science behind the decision making of whether a patient needs one-to-one care or not.
It's been really useful to use the PDSA cycles because it keeps you on track.
What did you really want to join this programme to do?
I think it was around improving our patient care, improving our relationships with carers, and also really focusing on the care that we were giving to make sure it was appropriate, and that we could actually demonstrate the quality of that care.
Well, from my perspective as a falls nurse, mainly that the patients feel safe, to reduce the levels of harm that's happening across the trust, and just enhancing their care whilst they're with us, and making sure that they feel safe with the relatives and the nurses that are providing the care.
What do you think is the one key thing that you've achieved throughout this programme that you're really proud of?
Empowering the staff nurses to actually partake in reassessing patients for everyday enhanced care.
What is it that you have enjoyed the most about doing this programme?
I think we have enjoyed sharing knowledge, because you never know how much knowledge is out there until you really get together as a team. So we have learned quite a lot to take back with us.
One of my main objectives was to change people's views on kind of enhanced care specialty. I think we've managed to do that so far, which is great.
What I enjoyed most of the program is learning from other colleagues. It's better to learn from others, and how you do it in the ward. And for us now, it's 90 days, and how we share it to the other team.
So I've seen the team grow and develop in confidence in their ability to be involved in change, to steer change. And as far as the project, and most importantly the patient goes, I'm seeing patients being properly assessed, and the right people with the right skills looking after those patients that are our most vulnerable.
In one word, how would you summarise this programme?
Exhilarating.